tonight.
Growing up, I always was bigger than everyone else.
I was always 20, 30 pounds over what kids should be.
An ABC 27 special presentation.
My father passed. That was where I went from 330 to about 380.
I was at my mom's house and I just weighed myself and I was 282 pounds. I asked her if I was going to die because of my weight.
Penn State Hershey Surgical Weight Loss presents The Wait is Over, Exploring Surgical Weight Loss. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Deborah Pinkerton. Today, so many of us work long days and shuttle our children around to a variety of activities. It's often a challenge to eat a healthy meal. Obesity has become a problem for people of all ages. 2 of 3 people in most countries have a problem with their weight. In the United States, 1/3 of American kids and teens are overweight or obese. From 1971 to 2011, childhood obesity doubled in children and quadrupled in adolescents. And now it's the #1 concern among parents. Tonight we're here to explore one solution: surgical weight loss. Amanda, Penn State Hershey Surgical Weight Loss is unique. It offers a program for teenagers. An Adams County team was the first to go through it. Take a look at Tanner Auditor's weight loss journey.
Ready to go?
Yes, sir.
There you go. And take your lock off.
Hunting season is in, and Joe Auditor and his 17-year-old son Tanner are ready.
All right, let's go.
But this year, scouting for a buck will be different for this father and son.
The hills that we had to walk up were incredible with how steep they were, to be able to actually get traction as well with your own feet as well, to be able to walk up.
Would you get out of breath?
Yeah. By the time you'd get back up to the top, you wanted to just sleep for the rest of the day, to be honest.
Trekking through the forest will be much easier for Tanner because he's in better shape. He lost 100 pounds, all because of a decision he made when he was 16.
He was very determined. He wanted to lose weight. He wanted to be a normal kid. And I think that's what motivated him the most, was he wanted to be just like everybody else.
A feeling Tanner never really felt.
Growing up, I always was the bigger child. I was always the kid who, was bigger than everyone else.
I think at a young age, he started to use food to pacify himself.
Chips mainly and candy. I even started sneaking food from my parents so that they wouldn't know that I was eating as much as I was, and I just blame it on my brother for the food disappearing.
The doctor actually sent us to a nutritionist when he was 9 or 10 years old. Went to the nutritionist, talked to them, gave us diets. We were following the diets, and those diets didn't seem to be working. If anything, he was gaining weight.
And as he progressively got older, he got bigger, and like when he'd play goalie, we'd call him Tank. He'd run through everybody because he was just that much bigger than everybody else.
I think in 9th grade I might have been like 180, 190, and as the years progressed it just kept on going up, and I think by the end of 10th grade I was about 260.
I felt helpless. I felt bad. I was like, this is something I should be helping him with.
When your son, your 14 or 15-year-old weighs more than you do, and I'm not a small person in the first place, it's just not good.
Tanner knew it wasn't good either, especially when he stepped on the scale.
I was 282 pounds at that point.
He came to me and he seemed very sad. He was very upset. He was crying.
I asked her if I was going to die because of my weight. And at that moment was when I realized that I needed to turn everything around, or else I might have died from having too much weight on me.
You don't ever want your child to ask you, am I going to die? Especially you don't ever want that, but especially when it's not a disease-related problem.
I always worried about that. Heart issues run in my family rather well, and knowing the extra weight that he was carrying, did I question myself, would he make it? Yes.
when he came to me that devastated, I knew that, hey, maybe we should start looking at some other options in his weight loss.
Surgery was another option.
We saw your episode on TV.
The Wait is Over, exploring surgical weight loss.
And I immediately called Trish and I told her about it and I talked to Tanner about it, and then we jumped right into it.
They made an appointment and met with the staff at Penn State Hershey's Surgical Weight Loss.
What was so interesting about Tanner was that he was the driving force behind the changes that he made, and that's what we're really looking for with an adolescent, is that from the very beginning he was highly motivated to make behavioral changes.
Those changes included diet.
So Tanner initially was not eating breakfast. So he started eating breakfast. He was eating higher fat and calorie items, and we started incorporating more vegetables into his meal plan, more fruits into his meal plan.
Because of those changes, Tanner lost 26 pounds before the surgery.
Right before the actual surgery, whenever I was laying on the operating table, I thanked them because what they were about to do was going to change my whole life, and I trusted them with my life, that they would be, that they had my full support in that. And from that moment on, I was fine.
Tanner had the sleeve gastrectomy, and that's an operation where you're actually removing about 70% of the stomach. So the larger, stretchier part that will hold more is removed, and that leaves you with a narrow tube-shaped stomach, which is what you now eat into.
Tanner chose to have the surgery on New Year's Eve.
I wanted to wake up a new person, is what I told my parents, is I wanted to wake up the next day, be a new year, a fresh new start to my life, and be able to change it around from that point on.
Tanner's life did change dramatically.
Every time I hit like a major milestone, kind of like as I was going from that 250 something down to 240 or down to 230 or something like that, I'd always make some kind of Facebook status or something like that. And my goal truly was 180 was my weight, and now 179. It just feels amazing to be that low again.
Instead of eating, Tanner's new pastime is running. He ran his first 5K last fall.
I cried after I was done because I was proud of myself. You know, I set it to be a goal after my surgery that eventually I would run a 5K, that I wanted to do that.
He's in good shape. Oh, makes me feel great. I mean, I think he's got a great future ahead of himself. I don't see any health issues.
Now these are much better snacks than those chips, aren't they?
Yeah, way better.
I'm very proud of him. I'm very proud of him in the whole journey that he's taken through this. He's had to put effort into it. He has done this. We didn't do this.
These are my old pants. I used to be a size 46. I wear a 34 now.
So this is the new Tanner.
Mm-hmm. This is the new one that I am proud of. A lot of people are proud of me.
And many people are proud of Tanner. His parents supported him throughout the entire process. And as a surgeon, I'm sure you're proud of him too.
Very proud of him. He's a great kid.
Joining us right now is Dr. Ann Rogers, the director of Penn State Surgical Weight Loss Program. Thanks for being here. Tanner was your first adolescent patient. What prompted you to offer something for adolescents?
Our adult patients were actually asking about it because their teenage children were becoming heavy as well, and they wanted to know if this was available for them. It wasn't at the time, but we saw the need to start a program.
And right now, you're really the only place here in central Pennsylvania.
We're one of only 2 nationally accredited surgical weight loss programs for teens.
And tell me, as far as what are the medical requirements? Is there anything that's done differently when you're dealing with teens compared to adults?
Not Not really. They need to go through the same process as their adult patients do. Sometimes it takes longer with teenagers because they have special problems like not being able to drive themselves to the visits and things like that. They depend on their parents, but they come to it independently and they have to independently want it.
And they go through that same 6-month program.
Correct.
And how do you prepare them to keep the weight off?
Our patients learn throughout the program not only about how to eat properly and to pre-select portion sizes, they learn a lot about exercise and how good exercise is at helping you keep off the weight that you have already lost.
And I know some patients may be scared to have surgery at this point. What programs do you have for teens who are just not ready to make that commitment?
We really feel that our patients should come to it ready to go, and Tanner really was the one who initiated this. He wasn't brought in by his parents. He really wanted to do it for himself. He wants to be an active kid. He's very friendly and sociable, has a lot of friends, but he found that he wasn't able to do everything he wanted to do.
Okay, great. Thank you, Dr. Rogers. And why don't we go into the ABC 27 call center and see how everything's going over there. Amanda?
Thank you, Deborah. The phone lines are very busy, off the hook, ringing right now with a whole bunch of questions from our viewers. If you have a question, you can call in. The number is 717-346-3333. Now, we do have some of those viewer questions, and here to answer some of them is Dr. Randy Halleck. Thank you for being with us. So the first question from a viewer is, they had the lap band procedure about 10 years ago. Now, since then, they've gained some weight, and the person's blood sugar is very high. Can this person have a second weight loss surgery, and will insurance pay for it?
Well, that's a great question, and we've seen great results with weight loss surgery, but on occasion patients do regain weight, and unfortunately their medical problems can return as well. When that happens, we have a number of options for them in terms of counseling, endoscopic treatments, and revisional surgery when appropriate. And yes, when patients do regain weight and when there is a return of the medical problems, most of the times insurance will cover treatment for that.
Good. Let's go to our next question. What are the long-term risks from having weight loss surgery? This person has a family history of cancer. They're concerned about possibly needing chemotherapy in the future.
Well, from decades of experience with these types of operations, we now know that they're safe and there are very few long-term side effects. People go on to lead very normal lives. Of course, obesity can be associated with an increased risk of cancer in and of itself, so treating that may help with that. In terms of dealing with something like chemotherapy, most patients with weight loss operations can go through that safely and with very little impact on their treatment.
All right, thank you.
You're watching The Wait is Over, Exploring Surgical Weight Loss on ABC 27, brought to you by Penn State Milton-Hershey Medical Center.
Welcome back. If you've been to a Penn State football game, I'm sure you will recognize this voice. Now Dean DeVore is using his voice to help others. Here's his weight loss journey.
Ladies and gentlemen, we welcome you to Beaver Stadium for today's Big Ten football game between the Fighting Illini of the University of Illinois and your Penn State Nittany Lions.
Dean DeVore Othofer is the voice of Penn State football.
Please welcome your Penn State Nittany Lions.
For 16 years, his voice has resonated throughout Beaver Stadium.
Hackenberg to Barkley, first and goal, Penn State. I do what I do not for me. I do what I do in terms of my announcing sports for Penn State to magnify the athletes. It's their thing. Barkley on the carry.
But a few years ago, Dean knew he needed to focus more on himself. His weight was the reason, something Dean struggled with since he was young.
I wasn't the kid that was necessarily looking like everybody else. I was husky, I was a bigger kid.
The weight gain continued as Dean entered college.
When I got to Penn State as a student, I was probably 190 to 200, and I would say I was in the low 200s when I was going to college.
Dean tried a number of diets, but nothing seemed to work.
It was that typical journey, 230, 240, 250, lose 20, 30, but then gain 50 or 60, and then it just kept going.
Dean's Dean's partner of 14 years, Joel Hernandez Alejandro, became concerned.
As the years went by, he put on more weight, then more complications start coming in.
My health was terrible. I mean, at that point, I had tremendous sleep apnea.
Dean's father's passing triggered him to gain even more weight.
It went on pretty quickly after he passed. That was where I went from probably like about 330, I would say, to about 380.
Dean knew his life was headed in the wrong direction. It was time to consider surgery.
I think he was just really concerned about his health, and he was getting to the point that he just couldn't do the things he wanted to do, and he was very, very busy and wanted to continue to be busy because he's a young guy.
Initially, I wasn't on board with it. I honestly saw it sometimes as an excuse or a shortcut to losing weight.
But Joel and others saw the difference in Dean after he enrolled in the surgical weight loss program.
He was very committed to starting an exercise program, to implementing that. And it took him a while to get that going, but he wanted to make that a regular habit, which is always a challenge for our patients.
So you're going to reach up, you're going to actually come straight down.
The one key person to this whole thing, his name is Mike Zahner.
Mike Zahner meets with all of the surgical weight loss patients.
What happens is they get referred to see me, and they come in for an exercise evaluation. And what that is for is to make sure that we get them started exercising prior to the surgery. Inhale as you're coming back, exhale as you're exerting.
I remember my first meeting with him, which was for him to, I think, assess where I was and to draw up a plan to go forward.
He came in and he sat down and he says, I'm not somebody that goes to the gym. And I said, okay, that's okay. Let's give you some things. How about you go buy 5-pound weights and we'll start from there. So you're gonna pull straight through, right up through. Throughout his whole 6 months of coming through the program, he did a tremendous job, checking with me every week.
I started in December. About February, I remember emailing him and said, you know what? I went over to the local gym and I joined. Can you give me some different exercises?
Because of exercising and changing his diet, Dean lost 40 pounds before surgery.
I remember that triggered a conversation. That triggered a conversation with my partner, Joel, that, okay, you've done 40 pounds on your own. Why can't you do more?
Dean was not. He was like, no, I've gotten here to this point. I want to continue with the program. I still want to do the surgery.
Dean chose to have the sleeve gastrectomy.
So the sleeve gastrectomy is an operation where we make a narrow tube out of the stomach. So patients are left with a tube-shaped stomach that's a lot smaller than the big-sized stomach that they had previously. I think probably one of the most important parts of this operation is that by removing the big part of the stomach, you're removing a lot of the cells that make a hormone called ghrelin, which is what's telling you how hungry you are. So sleeve patients frequently report, I'm just not hungry.
It almost felt like, putting one chapter of your life away and maybe going into a new chapter.
The new chapter of Dean's life began immediately after surgery.
I know that first month, it was almost a pound a day, which is it gets a little heady after a while. That's almost as addicting as food can be, as that rapid weight loss.
After the first 100 pounds, 120 pounds, it slows down, so you'll still lose weight, but not as fast as that first month.
When the weight loss slowed down, Dean increased his exercise at a fitness club in State College.
Dean and I started training together about 1.5 years ago now. My mission with Dean wasn't weight loss. It was teaching his body how to move again.
Dean goes to the gym several times a week, a healthy routine that has changed his life.
Right now I've been holding for about the last 2-3 months at about a level between 215 and 220 that I'm comfortable with. My trainer's comfortable with it, and I still got a few things I'm working on, but for the most part, I'm pretty happy with the things I've done with my body too.
I feel very proud of him. Very proud. I mean, he knew he had an issue with weight. With the surgery, he took weight and stumped on it, and that has changed his outlook in life.
It'll be 3rd and goal at the 5 for the Nittany Lions. I feel healthy now. I'm excited to get up every day. It makes me want to just do as much as I can in my own life and to hopefully try to help other people too.
Touchdown, Penn State!
A touchdown for Penn State and a touchdown for Dean. Since the surgery, he no longer has any health problems like sleep apnea or high blood pressure. And Dr. Rogers, both Tanner and Dean had the sleeve gastrectomy. Talk to us about that.
It's been actually the most common operation for weight since about the year 2013, and most of our patients are requesting that instead of the gastric bypass.
And what is the recovery like with that type of surgery?
It's actually remarkably quick. Our patients go home the day after surgery. They take pain medications for maybe 3 days afterwards, and most people go back to work in about 3 weeks.
And it's minimally invasive, correct?
Correct. Very small incisions.
And how important is exercise after the surgical weight loss?
It's absolutely key, and I think the amount of exercise that Dean has been doing led him to have more weight loss than I would have expected with this operation.
Okay, Dr. Rogers, thank you for being with us. And let's check in with Amanda, who's in the ABC 27 kitchen. Amanda?
Hey, Deborah. Yes, we are in the ABC 27 kitchen with registered dietitian Janelle McLeod. Thank you for being with us. One of the most frequently asked questions that we get from viewers is about what they can eat after weight loss surgery. And a lot of people are curious about restrictions. So tell me, are there any restrictions?
There are no restrictions after surgical weight loss, but patients need to make healthy food choices most of the time in order to lose weight and keep the weight off.
And that doesn't mean that they have to cut anything out. One, favorite with people are chicken tenders, and there are ways to make some of those favorite foods that you might get at a restaurant or in a frozen food a little bit healthier. Tell me about these.
Well, these chicken tenders are simple to make. In less than 30 minutes, you can season and bake them and save up to 200 calories and 14 grams of fat. Pair them with like a side of vegetables and whole grain rice, and you have a well-balanced meal.
Yeah, absolutely. These look great. You have all the different options. You can put them on top of a salad. When we think chicken tenders, though, a lot of us think toppings, and there is a way to have those toppings too for a little bit of a healthier option. Tell me about those.
Absolutely. If you like buffalo chicken tenders, the buffalo wing sauce is really good. It's usually low in calories and fat. You can try honey mustard made at home or barbecue sauce. Some of the other creamy dressings like ranch and blue cheese you have to be really careful with. Choose the light versions and small amounts.
All right, and we will have the recipe for this on our website. We also want to talk about dessert, my favorite part of the meal. There is a way to have a favorite baked apples for a little bit healthier too. Tell me about that.
Absolutely. So a lot of these baked apple recipes come with a lot of brown sugar and butter, and the way I've done it at home with my family is I take an apple and I put a little bit of spray butter and some cinnamon and throw it in the microwave until it's nice and soft and dollop with Cool Whip, and we're good to go for a nice healthy dessert.
All right, and we do have some special guests here joining us now, our Dean and Tanner. Please join us, and we're going to have you guys try some of these chicken tenders and let the viewers know. You can
I hope you can get it out of there. Sure, yeah,
there you go. What do you guys think?
Good. It's always about substituting what you tasted before with good, healthy stuff. And I think Janelle and everybody at Hershey, that's what they teach you. It's like, eat the good stuff, but don't skimp on flavor. Flavor is important. Right?
Exactly. Yeah. And so we're going to send things back to Deborah in the studio. We'll have you enjoy your chicken tender. Bye, Deborah. Or here you go.
Thanks, Amanda. Now joining us is Dr. Eric Pauli, the Director of Endoscopic Surgery at the Med Center. Now, in some cases, patients have actually ended up gaining weight again. There is an option for them, correct?
So certainly, after weight loss procedures, we know that people can regain weight. You saw with our two patient profiles there that they had both committed to diet and exercise as part of their lifestyle changes. But we know that in some people there are problems that can happen with the bypass or the sleeve that we can fix, and those options are endoscopic options at our facility. We use a special plication tool to perform a procedure that we do through the mouth to narrow parts of the bypass or the sleeve to help people regain a sense of fullness after meals and lose weight.
And how do you actually qualify for that procedure?
So the first thing we want to do is look with the scope and make sure that we can identify something that is repairable. We look for dilations in the connections in the bypass or in the sleeve, and if we find them, we send people back to our weight loss clinic. They have to commit to doing a 6-month program ahead of time to help them redo their education about exercise and healthy eating habits. And then we perform the plication procedure, which is essentially an outpatient procedure that we do with no surgical incisions, again, to give them a sense of restriction and satiety after meals.
And how successful is this?
People can expect to lose about 60% of the weight that they've regained after their procedure. Patients can do better than that. Some patients do worse than that, but on average about 60%. The patients who do the best are those who are eating healthy and exercising.
Okay, Dr. Pauly, thank you for joining us tonight.
Thank you.
We also want to thank the specialists here tonight for answering your calls and our viewers for sharing your stories and sending in your questions. If you would like more information or you would like to schedule an appointment with Penn State Hershey Surgical Weight Loss, call 717-531-7260 or visit online at pennstatehershey.org/SWL. Thanks for watching tonight, and we wish you good health.